I will begin questioning, and my questions are directed to each member of the panel. Healthcare reform was supposed to make healthcare more accessible and affordable. Do you think the new law does anything to help reduce the cost of healthcare? And I'll start with Mr. Jost.
Yes, and one example of that is the medical loss ratios, which has already been discussed. I follow the medical loss ratios very closely. I was very much involved in their drafting through the National Association of Insurance Commissioners. One of the things that people are beginning to notice is that growth in healthcare costs has been dropping in the last couple of years. There's another report on that out this morning. At the same time, in the very recent past, insurance profits have been growing very, very rapidly. And people who follow the insurance industry closely are saying that if insurers have to spend 80% of their premiums on healthcare costs and costs are dropping, premiums can't continue to rise. They're going to come down. And we already saw that in Connecticut, where one insurer dropped its rates by 10%. We're starting to see it in other states. I think, in fact, that the MLRs is going to have a dramatic effect in reducing the cost of health insurance for employers and individuals over the next couple of years. And if I could just add quickly, one question that was asked earlier was, will it drive small insurers out of the market? I've read all of the state adjustment requests that have gone final. In only one state have any insurers left since the law went into effect. And as Mr. Larson said, people are talking about it. It isn't happening. Thank you.
Mr. Vaughn.
Well, I certainly would have no way of knowing. I'm not an academic. I'm a business person. But let me just give you a few numbers so you can kind of understand my situation. If you take 2010 in my small business, I'm a sub-Chapter S corporation. So at the end of the year, the bottom line of my company was $319,000. If I took the way this plan exists now, if I took this plan and I insured all of my employees the way it's designed, it would cost me $307,000, okay, which leaves me $12,000. Now, understand, I'm taxed personally on the net income of my company, all right? But do I take that money? Absolutely not. What I do, I have to turn that money around and reinvest in the building, buy new equipment, and those sort of things. $12,000 doesn't even leave me enough to pay my taxes, let alone reinvest in my business. So, and the other piece of this is, I'm not likely to pay a penalty. Why would I do that? Because I'm not really helping anyone. And the penalty would cost me as much as the insurance that I'm providing now. So if this thing continues on the path it is, I can tell you right now that I will do everything I can to avoid paying the penalty. I will probably more than likely drop coverage. And what it will do to the cost of insurance, I have no idea. Thank you.
Mr. Dennis.
Oh, excuse me, thank you. One of the things that's really important to remember is that when we started this thing, small businesses were very much in the forefront of calling for reform on health care. And the reason was cost. Cost was driving us nuts. This morning, I believe I opened the Journal and the Wall Street Journal and saw the study was out from the Social Security Administration, which projected that under the plan, under the bill, costs would rise faster than they would otherwise. Wasn't a great deal, but it was indeed faster. That's the first thing. The second thing is we're talking about relatively, recently we've had some lower rates than we've seen over the past several years, and it's been attributed some quarters to indeed the new law. But in effect what we're seeing is in this recovery, very different from the last 5 recoveries, is that the relative demand and the relative purchases, if you will, of various services have been much slower than average. And healthcare has been one of them. Whether it's people not having the money to go or being more parsimonious and considering something that they really didn't need once they thought about it, I don't know. I don't have any idea. But still, the whole thing is that this is a very abnormal period. Mm-hmm. And then we start looking at everything that's inherent. You're going to have minimum benefits, and while we don't know what's going to be in the minimum benefit package clearly, as Mr. Vaughn's example shows, there's going to be a whole series of folks that are either going to have to add a lot more or not do anything. Then we have all types of expensive things that we haven't even talked about, which don't necessarily directly affect smaller firms, but some things like the Class Act and all these kinds of things. And then we have, of course, a whole lot of new folks coming on. So all this together is going to drive costs higher, I'm afraid.
Thank you, Mr. Dennis. Dr. Holtz-Aiken.
I would largely concur. In analyzing the bill as it passed and became the law, the CMS actuary, the administration's own actuary, concluded that it would raise, not lower, national health expenditure. If the national health expenditure bill is larger, the insurance that covers that bill has to be larger. There's no way around that. And when the CBO put out its new long-term budget projections, it found that after the passage of the law, things went up, not down. The law contains 2 new entitlement spending programs. The CBO estimates they grow at 8% a year as far as the eye can see. There's no evidence of bending the cost curve anywhere to be found in those kinds of numbers. And so if you dial the clock back to the beginning of the debate, there were 2 criteria by which any health care reform should be judged, the ability to cover more Americans with affordable and quality insurance and the capacity to deliver those services with lower cost and higher quality. And the Affordable Care Act flunks the latter, which is ultimately the fundamental driver of insurance costs in the United States. And so things like the MLR are mere fiddles at the edges of a tidal wave of health care spending. And unless we get the tidal wave under control, the premiums go up.
Thank you. I have one more question for you at this time. Do you think the health care laws, mandates, and taxes, along with the numerous regulations that are being issued, make it less likely that small businesses will hire more workers and expand their companies? And again, I'll start with Mr. Jost.
Well, small businesses, there are some incentives and disincentives. There are benefits under the law that small businesses get, that large businesses don't get, and there are some benefits that large businesses get that aren't available to small businesses. For example, small businesses need to cover the essential benefits package. It's not clear to me that that's going to be a major expense because, in fact, what happens is that state mandates are going to go away, and it's not at all clear the federal essential benefits package is going to cost more than state mandates. But that is something that small businesses need to cover that large businesses don't need to. On the other hand, large businesses need to pay the penalty if they don't cover their employees, and small businesses don't. I come from a family that started a small business about 20 years ago, and my brother-in-law started it borrowing money from the rest of us in the family, and it is today a $300 million publicly traded company, and its product is a household name. They didn't worry about, am I going to get this benefit or lose this benefit if I grow a little bigger? They tried to help out their employees, they tried to help out their customers and sell a good product, and I think that's the way American businesses work. And I think that under this law, it's going to continue to work that way. It's just that employees and individuals are going to have better health care coverage.
Mr. Vaughn.
Well, I can just start out by saying that over-regulation is killing small business. Let's just go back to minimum wage. I've already scaled down my staff, and I'm running frankly, as lean as I can possibly run right now and make a living. The reality is there are going to be virtually no full-time jobs in this industry. And I can tell you the way it will work in my company is only my management staff will be full-time. Everyone else will work 29 hours a week or less. And it's just that simple. We cannot afford this thing.
Thank you, Mr. Vaughn. Mr. Dennis.
Well, right now, immediately, the overwhelming issue is uncertainty. We have absolutely no idea what's going on, and I think everybody would agree to that. I don't think that that's a very controversial statement. Nonetheless, that has an enormous impact on what you're willing to do in terms of hire and invest. And we're seeing that very clearly within the small business population. We do this monthly survey that we've been doing since 1973, and it's constantly showing that small businesses are much more pessimistic and feel much less, how can I say, favorable towards the economy than do larger folks. And that's borne out by their sentiment is borne out by a whole series of measures, including some that are contained in a recent Federal Reserve of New York paper that's just out. But that's the immediate thing. Longer term, you have the whole issue of cost and taxes, and they go together. And what does that have to do? Well, it simply means that if you don't have it, if the government has it, then you don't have it, and you have less available to do that. And so the question is, you can't invest if you don't have it. And then we have the interesting issue of growth, and does the 50 divide mean anything? And for some firms, it clearly will. And it won't mean just do I go over 50 or not. It's whether I hold back a little bit from 50 for fear that I'm going to be hung up on that whole thing. There will be a lot of firms, excuse me, who are growth firms that, as Mr. Jost used as an example of his brother-in-law, that will just go blowing right on by. I mean, they're going to be high growth firms, and they're not going to pay attention to anything. But it is going to have an impact on a whole lot of small firms.
Dr. Holtz-Aiken.
Well, I guess I'd echo the firm level recognition of the regulatory costs that Mr. Vaughn mentioned. I think I'd echo the uncertainty and the firm level growth incentives Mr. Dennis highlighted. But if you step back and look at the basic architecture of the Affordable Care Act, it says, let us spend $1 trillion over the next 10 years and finance that by raising $500 billion in new taxes, much of it on inputs into what will be paid for by insurance, and thus make insurance more expensive. And let's finance the rest by cutting $500 billion roughly out of Medicare, something the CMS actuary has said is simply economically unrealistic and would mean the closure of a large number of hospitals and failure to serve those beneficiaries. So I take that with a grain of salt. What you have in the end, then, is higher taxes, much larger deficits, in a recovery that's utterly unsatisfying, and I cannot conclude that that's going to be beneficial for the hiring practices of small businesses.
Thank you, Dr. Aiken. I now yield to Mr. Altmeyer for questions.